So you do hormone optimization or bioidentical hormone replacement therapy using pellets. Who's a candidate for that?
I think candidates for bioidentical hormone replacement therapy are those patients or those people who are experiencing fatigue. They just don't have that pep in their step anymore. They're not sleeping well. You know, we have both men and women in our practice, and I oftentimes will say the women actually bring the men into the practice, usually their husbands. But as we age, Randy, what ends up happening is that our hormones actually begin to decline. And as the hormones begin to decline, as does our function. And so what we do in our practice is we basically do a full assessment and try to determine which symptoms that these patients or these people are actually coming to our practice are exhibiting. It could be lethargy, fatigue, tiredness. Maybe you're actually in the gym now and you're not gaining as much muscle as you used to. Maybe you're gaining weight. That one's a popular one. And then also intimacy. Maybe something is actually a little bit off in your intimacy life. So these are great candidates for hormone replacement. We've had patients as early as 30s coming in. We have a patient, actually a husband and wife who's 80 years old, and I think about them. They're actually gone on their third honeymoon now on a cruise. But basically anyone who is feeling the results of aging are a candidate for hormone replacement.
So the pellet therapy, let's talk about that. So you take,
let's do it.
What hormones are you actually putting in the pellet, and then how do you insert it in the body? How does that work?
So the hormones that are actually going into the pellet include testosterone and estradiol for women. And these pellets are the size of a grain of rice. They're very small. They're actually inserted underneath of the skin, and it basically goes into the fat. Mine's right here. I'm actually using it myself.
All right.
So over the course of the several months, over 3 to 4 months for women and 4 to 5 months for men, this hormone pellet, again, size of a grain of rice, releases into the bloodstream and basically optimizes and normalizes your hormone levels. So within a few weeks of inserting the pellet, for women, for example, they're finding that their energy is better, their moods are improving. I have a patient that comes to mind, her migraine's actually improved. Their libido goes up, they're finding that they're connecting with their partners more, and they just feel better. They're going to the gym, they're getting more lean muscle, they're losing weight, and they just feel happier. They feel, oftentimes I hear the phrase, just more like themselves again.
Now, a lot of doctors are doing bioidentical hormones, right?
You
must have a bias that as a gynecologist, they should, I mean, who knows women better than you do?
Yeah,
right?
Well, I think it doesn't cost anymore to see a physician who specializes in female medicine. And as a GYN, you know, I've been actually trained on a variety of different kinds of hormone applications. So there are other delivery systems for hormones. You could use creams, you could use injectables, you can use other ways to deliver hormones. And you could even use a troche that actually goes into the mouth. But that being said, each one of those has its pros and cons. And to that point also, are we talking about synthetic hormone? Are we talking about a bioidentical hormone? Even those are different.
But what about those critics that would say, but even though it's bioidentical hormone replacement, it's still not natural?
Well, I mean, having emergency surgery is not natural. I mean, we have technology now, Randy, that enables us to live and age gracefully. This is really the new aging gracefully.
So you're taking a woman, let's say 40s, 50s, and you're returning her hormone levels to an 18-year-old, or maybe that of a 30-year-old? What do you
say between a 20 and 30-year-old. I mean, you kind of poll the average patient and when they felt their best. I don't say, do you remember when you used to feel 40? I usually say, do you remember in your 20s when you used to have a higher libido, better energy, you could eat what you want, you can you know, have energy to basically exercise and pursue those life things. Most women want to feel like they're in their 20s to 30s.
So when should somebody do it? As a gynecologist, I mean, when should they do this? Is it when they start missing or irregular menstrual cycle, or 1 year without a menstrual cycle? I mean, when do they do it?
Well, it depends. So the patients who come and see me in their early 30s, for example, they're usually complaining of a lower libido and less energy, maybe an inability to lose weight that they used to. So for those patients, in our very comprehensive assessment, that which includes laboratory work, we optimize thyroid and testosterone usually. And the reason we say usually is usually they're not deficient in estrogen. And it's more the patients who are in the older category, that is over the age of 45, maybe into their 50s, when they're starting to exhibit signs and symptoms of estrogen deficiency. And so for that, we would end up combining testosterone with estrogen and putting in the pellets.
And progesterone also?
And progesterone. And do you know what progesterone does?
No.
In most cases, we use progesterone to PR, just like the word progesterone, it has the letters PR in it, protect the uterine lining. So if women have a uterus and they take estrogen alone, then there are untoward effects of estrogen on the uterus. You could actually cause abnormal bleeding at the uterine lining if you do not PR, project the uterine lining with progesterone.
So with this hormone optimization,
Yes.
you start taking it. How soon do you start feeling better?
I would say within a few weeks.
They notice a difference.
They notice a difference, yes. So everyone's a little bit different, but most patients feel something within the first few weeks.
But do women really need testosterone?
Absolutely, and it's so interesting. Women produce testosterone, Randy, from the ovaries, and it would be as if I were telling you that men don't need estrogen. But when we think about traditionally what's reserved in our minds, what a male hormone is and what a female hormone is, it's just ludicrous that we would think that we don't actually have these hormones. For example, we actually, men, we need a little bit of estrogen, because if we don't, we experience some emotional changes, we could have emotional liability. And the thing is, it's really important that we understand that both men and women have testosterone and estrogen.
Now, are there any risk factors? What about women that have had cancers in the past, things like that? Can they still get this pellet therapy?
Well, it depends. So
this is your specialty.
So this is, so in my professional opinion, I think women who have had some kind of gynecologic malignancy, I think that's what you're getting at, either uterine cancer, cervical cancer, it depends, and it really does based on the case. So a patient who, for example, has had uterine cancer in the past and has just already had a hysterectomy, why wouldn't you give them hormone replacement? It actually improves their quality of life and actually causes them to have healthier outcomes.
Is it protective? I mean, bioidentical hormones, this pellet, I mean, does it help the heart, help the brain, things like that? Is there any studies that show this?
So many of the studies show that optimal hormone replacement when started before menopause actually is
before menopause.
Before menopause is cardioprotective, protects your heart, protects your bone. Actually, a lot of the original estrogen studies were based on trying to build up bone using estrogen. And so they found out in the 80s that you couldn't give estrogen alone without progesterone. And that's where all these issues really came from, Randy, is the fact that we were using different forms of hormones in the wrong candidates in the wrong way. We now know with the technology that's afforded to us, particularly with this pellet therapy, that we could place hormones in a very precise way depending on what the symptoms and the labs are, and follow our patients carefully.
Does it mimic these pellets? Because talked to a doctor, he said the problem with the pellets is you can't you can't predict how much it's going to release. That's why they like creams or injections or pills or whatever. So is it released evenly? And how do you manage that?
It is actually.
Work?
So when patients first come see me, they get a baseline set of labs, and I tell the patients this is the absolute lowest your hormones are going to be. The patients then get a pellet placed, and after about 4 weeks for men and 6 weeks for women, they come back and review their labs. We now have a low point, and then we have a high point of where their hormones are. And over the course of several months, the hormones actually remain stable, which is just why I love the pellet delivery system. You don't have a wax and waning up and down like some of the creams, which are actually also user dependent, and the injectables. I mean, who wants an injectable every few days? That just hurts. And so this is a great delivery system that's consistent, that's based on precise dosing. And really, precise dosing is the key.
Now, you tell me stories of people thinking better, where they have a clarity of thought, they're sleeping better, they have more energy. Is it the testosterone that's doing that, or is it just the combination of hormones and also nutrition that goes along with it?
I think testosterone has a good deal in playing a positive role on some of these symptoms. The energy, the libido, definitely. Some of the fatigue, the mental fog. A lot of my patients will say they can't even keep awake after lunch. And remember, most of us work 8-hour days. So at the end of a lunch, if you can't go back to your second part of the day, it's going to be,
and
it's
that
going to
can go away? I mean, you hear women saying it goes away?
I'm hearing this from men. I'm hearing that from women. I also hear, and here's my marker for success. When I pair with my patients, I think that they should be able to go to the gym after 6. If they can go to the gym after a full day of work, I call that a quick win. And not only is it a quick win, it actually enables the patients to enable themselves to have several long-term wins. Because between you and I, how many people really go to the gym after work? You just feel too tired. That's what a lot of my patients tell me. They say, you know what, Dr. Tangchitnob, by 5, 6 o'clock, I'm so spent, the thought of even going to the gym, I can't even do it. But now with proper hormone replacement, patients are finding themselves in the gym again after work.
Now, what about those women that are taking birth control pills after 40 to make themselves feel better? Like that's their version of bioidentical hormones.
I think they're on the right track, Randy, and here's why. So birth control pill contains estrogen and progesterone, but to that point too, the estrogen and progesterone are synthetic. So they're on the right track because they're replacing some of what they are missing. Now, it's not the whole story because there's no testosterone in them. And so the patients are still citing that, yeah, they might not have hot flashes, their bleeding might be more regular, but they do not have all the mood, libido improvements, and energy, the ability to gain lean muscle mass
And the
and lose weight,
protective benefits.
and protective benefits that testosterone has on the heart and the brain, actually. Did you know testosterone could actually help and protect you against Alzheimer's?
No.
So that all of these are huge benefits to proper hormone replacement. There are things that you could feel in terms of benefits that you could feel, things you could see, and there are also things that are going on in terms of protection that you can't even see at the level of cholesterol labs and things you just can't see with the eye.
What about the woman that says, okay, I'm 50 plus,
Sure.
I'm feeling good, why would I want to do this?
Well, there's a lot of protective effects, right? So just because you can't see it doesn't mean that the hormones are not optimizing and working inside your body to protect you against Alzheimer's. They're helping with your bone. Maybe you don't have to be on that medication that protects the breakdown of bone now, because as we've known it, estrogen actually helps build bone. So as you're replacing these things as a woman, you actually help protect yourselves from the further complications that might happen down the road.
You think it gives women an edge?
I think absolutely it does. So the alternative to this is age. Your ovaries will stop producing all these hormones eventually, and you truly go into menopause and you experience all the symptoms that come with it. The fatigue, the hot flashes, the inability to sleep. Now, I can't tell you how many of my patients actually tell me that when they just don't get a good night's sleep, they feel lousy in the morning, and they actually accumulate what I call a huge sleep debt, which affects their energy.
So which hormone helps to sleep?
The big one is estrogen, plus and minus progesterone.
And then they're sleeping better. Do you have a lot of patients that are back to sleep?
A lot of patients are saying that they're sleeping more throughout the night, or the ones that are waking up in the middle of the night, that at least make it to the morning now. They feel refreshed in the morning, they get out of bed, they're ready to start their day. And that's an important metric.
I want to ask you about the psychological benefits. You know, when we're in our 20s, early 20s, late 20s,
Sure.
You have big goals, big ambitions. You want to take on the world more, and as you get older, that goes away. Do you think that's part of hormonal decline?
I think that's a testosterone
And do they get a
effect.
little bit of that back?
Yeah, I think you nailed it right on the head. That ability to get out of bed, go out, and own the world, conquer the world, a lot of it has to do with your testosterone levels and testosterone optimization. Now, is testosterone the only hormone? No. We have to look at thyroid, we look at estrogen, also progesterone if you need it. And I think really looking at the hormones as a system and how they interplay with one another and how they communicate, because that's really what hormones are.
Could you have a bad diet and take hormones and get great results?
You cannot, unfortunately. I wish you could.
Okay.
I wish you could just pellet and take thyroid and all of a sudden the fat just kind of falls off. But really, if you think about how the pellet works, it's placed under the skin. It's the size of a grain of rice. And as your heart rate goes up, as does your blood flow. So as the blood flow goes to the pellet and you're in the gym and you're working out and the heart rate goes up, it's pulling from the pellet, Randy, and more of that pellet is actually released into the bloodstream. So then you feel more optimal. Now, when you and I are asleep and we're sleeping, probably don't need such a high heart rate, probably don't need as much of that hormone released in the body, so it kind of slows down.
So is this something once you start doing, these people are hooked? Like they don't want to stop?
I think it's a good hook, Randy, and I think it's really interesting because why not be hooked on feeling good and making great health decisions for yourself?